Good morning. Today I am going to speak about a few things that is a very common problem in for children, for males, for females, old age group, many people throughout their lifetime. Many people keep it to themselves and without revealing it that they have a problem. This is a problem which affects their sleep in the night, that is related to the urination. Many people have problem like passing urine multiple times in the night. If they get up to pass urine once and in the night, it is fine. Up to 2 times is okay. More than 1 to 2 times in the night is a problem. That can be due to a lot of problems that is related to the urinary system or urine production. So when they have this problem, their sleep get disturbed, the sleep cycle get disturbed. As a result, there are a lot of changes that happen in the body and it affects their work and quality of life. So the first thing is the increased frequency of passing urine. That is, in the night they get up multiple times, 5 times, 7 times, 8 times to pass urine every half an hour, 1 hour, like that. Second is called the urge incontinence. They feel like passing urine, and before they reach the toilet, the urine passes out by itself. So that is involuntary passage of urine, urge incontinence. And burning sensation, pain, frequency, all these things comes in the night. So these things can affect a lot of people, including the children. In children, it can be due to a normal urinary tract infection, any problems with the bladder, the penile skin which can be tight, that also the children is not able to pass urine freely, all that can cause multiple problems. In male patients, it can be due to problems with the bladder. If there is an infection, there is a stone in the bladder, there is stones in the ureter. Another common thing is the prostate. When a prostate is enlarged, they have this increased frequency and burning sensation while passing urine. It can be there in the night. So that is a common problem. It can be due to bladder tumor also. So in females, when it comes, it can be due to recurrent urinary infection. Infection is a very common thing. Urinary tract infection causing this problem. Again, bladder stones, bladder tumor, bladder functional problems. There can be problems where the urine gets deposited in the bladder and it doesn't go out fully. So they will have remaining urine around 200-300 ml in the bladder and very less goes out. So every time they go to pass urine, they will pass around 10 ml or 100 ml and come back again 200 ml. So within half an hour again they go back to pass urine. So in old age, again it's due to bladder dysfunction, prostate, cancers, a lot of things. So problems of increased passage of urine in the night affecting your sleep is definitely has to be taken seriously, and we have to find a cause. Why is it happening? It can be absolutely normal. It can be just due to drinking more water in the night before going to sleep. So that reducing the water intake in the night can reduce this problem that can be there. Or they can have problem with the metabolism, hormonal changes or metabolism that can increase the urine production in the night. There can be different drugs, medications from different departments or cardiac medicines, nephrology medicines that is given to increase the urinary output. This also will cause increased urination in the night. So the thing is that if any of you are having this problem of getting up more than once or twice in the night and having these problems in the night, you definitely have to do investigations to find out what is the cause of the problem. And investigations include doing a routine blood test like creatinine, urine routine to find out any infection, and basically an ultrasound with post-void residual urine to find out if the urine is remaining in the bladder or completely going out. So these few things can let me know if there is any problem with the normal urinary mechanism or any block or any stones or any other problem. So once you do this, you should get a correct treatment to find out what can be done to reduce it. There are a lot of medications available now to reduce the bladder overactivity, bladder problems. So if you find the primary cause for this problem and treat it you will not have much problem, and you can have a peaceful sleep that will not affect your daily quality of life. So the last message I want to say is, if there is a problem like this affecting you, definitely meet a doctor, find out, do the necessary investigations, and find out exactly what is the problem, and it is absolutely treatable for most people. So you don't have to hide it and suffer in silence.